Today on Vital Signs, we're talking about why health screening is the smartest step you can take when it comes to avoiding serious health issues. Joining me is Shay Ganesh, here to unpack why knowing your numbers early could be the smartest insurance policy you'll ever take out. Shay, thank you so much for joining us today. What I really want to get into, and it's something that I think we all know we have to do but avoid, is health screening. Why is it so important to know where you stand, especially as you get older, but for any of us? Why is it so important to know up front in order to prevent illness?
So thanks for having me, Nikki. Great to be here. And it's really that time of the year. It's the beginning of the year. There's New Year's resolutions. People are starting to put down priorities about careers, families, personal, and health needs to firmly be up there. So I think, Nikki, it really is so important to know your numbers. And the reason we say this, and we strongly advise that you do this at least once a year, and lots of people advise do it at the beginning of the year, so that you have enough time to plan in terms of how you want to manage the rest of the year regarding your health. But very often, a lot of these chronic kind of diseases often sneak up on you. And it's a lot of them are often silent killers. So if you don't check, you will never know. And that's why we ask people to make that first step, take that first decision, go to your pharmacy, go to your doctor, and try and get the health screenings done. And this is really not too much of an ask, Nikki, because it's very basic stuff that we ask people to do. So simply knowing if your weight is in the right range, simply knowing how your blood pressure fluctuates through the day, how your glucose levels are looking, what the level of stress is in your life, are sort of simple markers that kind of guide us as to whether you have chronic diseases or you have the propensity to develop a chronic disease.
Why do you think people avoid getting the screenings done? I know a lot of people are afraid of what they might learn, afraid of the outcomes, and the truth of the matter is most dread disease is curable if we catch it early enough. So why do we still have this fear?
I suppose, Nikki, we're all human at the end of the day. We're all kiddies on the inside, and we're all just scared about a negative outcome. And I think a lot of the time it's exactly what you said. Everybody's worried about a negative sort of result, especially when individuals have to go and screen for cancers and things like that. And as you know, this is such a sensitive topic, especially if someone in the family has been diagnosed with this, and then doctor says everyone should be screened. It's obviously a very, very difficult time, and hence people often get scared. But the way around it is really to look at how can you demystify a lot of this. And I think a lot of it is about really empowering yourself with knowledge to learn a lot more about these things, and then also to have faith and trust a lot in your healthcare providers.
Yeah, exactly. What are the most overlooked screenings, or the ones that people avoid the most? Because I mean, weighing yourself is easy. Doing a blood pressure test is pretty simple. I mean, your healthcare provider will probably pay for that on your behalf anyway. It's for free. What are the things that we really avoid that we shouldn't be avoiding, the big scary ones?
So I think, Nikki, the timing of this discussion is really paramount. Yesterday there was quite a nice article that was released in terms of mental health claims in millennials and Gen Zs. Right. So this seems to be the highest disease burden in this age group, which is now telling us that people are not monitoring or checking their mental health and wellness. So a simple questionnaire done on a weekly basis, monthly basis, etc., can help you diagnose mental health and well-being, or kind of signal if there is a problem that's going to come up. So number one, definitely something that's overlooked because of the stigma, discrimination, or people just don't think it's important enough, is definitely mental health and wellness.
How do we screen for that?
So there's tons of questionnaires. So every app these days are tracking your mood, your sleep. They ask you questions. That's one. Then, of course, there's selected sort of healthcare questions that are directed at your healthcare, such as a pH9, etc. That's also found on a lot of apps, found on the internet, in social media, etc., where you can screen. And then, of course, a lot of people do actually reach out to colleagues, healthcare professionals, who can actually do the formal sort of testing and screening to kind of pick up exactly where the issues are.
Okay, and yeah, I mean, we're talking about Gen Z, and as we get older, we realize that it's more important to screen for diabetes and for heart disease. But what about young people? What are you seeing coming up in sort of the younger generations that could be avoided? Because we don't, who goes and gets blood tests for their 10-year-old? Unless there's a major problem and you know you should be looking for it. What are those screenings looking like?
So, Nikki, it's very scary. We're seeing tons of anxiety in this age group.
Wow.
So generalized anxiety disorders, social bullying in school, and we're seeing a lot of sort of areas where psychological safety is being compromised in this group. So that's one. And second thing I must highlight is childhood obesity.
Yes.
So we know that unfortunately does come back to that, but we're seeing tons of kids that are being diagnosed with high cholesterols, high weights that are out of range, obviously leading to tons of cardiac issues, renal issues and things like that. So in this age group, I think because of the whole advent of social media, there's just too much going on in that whole space, the peer pressure and things like that, that's often resulting in a lot of anxiety and things like that.
Okay, so for somebody watching, and they know they should be going and getting some tests done, where do we start? What is the most important thing to start with?
So it really depends, right? So viewers, if you're on medical aid, then your medical aid often covers what we call an annual health assessment, which is quite a comprehensive set of tests, and this is mandated by the Council of Medical Schemes. So it really doesn't matter which medical aid you're on, it's kind of a standard array of offerings. And like I said, they'll check your weight, they'll look at your glucose, they'll do some bloods for some cholesterol, your blood pressures. If you're female, usually in the age of 40 to 45, they'll suggest breast screening for a mammogram, especially if there's a family history, if a mom or a sister, somebody has been diagnosed. For males over 40, they will also suggest that they do sort of prostate screening. We look at colonoscopies, and then obviously to look at urine samples as well. So that's kind of your basic standard screening sort of stuff that goes through. And then also there's a lot that we must talk about for a pregnant mom as well.
Okay.
So there's a lot of testing that needs to be done for mom early in a pregnancy, genetic testing and things like that. A lot of medical aids are making these tests available now so that moms are forewarned and forearmed early in the pregnancy.
No, good. What would you say to the person watching who is terrified of the bad news?
So I think the most important thing is to trust your healthcare practitioner. So if you're going to get your health assessment done for the year, go to the doctor that you trust, that you have a relationship with. Go and see him, understand what test he's going to do, go read up about him, but look at credible sources. If you're on a medical aid, there's tons of reliable information that will come through their policies, their guidelines, their websites. Look at that, look at verifiable information, and then go and empower yourselves and get them done.
Educate yourself first.
100%.
Yeah, I think it's always the unknown that scares us.
Of course.
Even just on not knowing what the test involves. The more we can understand why, the better.
Exactly.
Dr. Shay, thank you so much for joining us today. It's been a pleasure speaking to you.
Great. Thanks so much for having me, Nikki.
Thank you. If there's one thing to take away from today, it's this. Peace of mind does not come from hoping for the best. It comes from knowing where you stand. Health screening is not about looking for problems. It's about protecting your future before problems get a chance to grow. Thank you for joining me on Vital Signs, the business of working well.